let us demonstrate the fourth ventricle. This is the fourth ventricle, as seen in sagittal section. It appears as tent-like and lies behind the pons and open medulla, which form its floor. It is covered posteriorly by the cerebellum. Its roof is formed by the superior and inferior medullary vela. This is the superior velum, and this is the inferior velum. The ventricle is continuous above with the cerebral aqueduct, and below with the central closed medulla. This is the fourth ventricle as seen from the back after removal of the cerebellum. It appears to be diamond in shape and is wide at the level of junction of the pons with the open medulla. Here it extends laterally on each side to form a thin ependymal tube called the lateral recess. This recess runs on the back of the inferior cerebellar peduncle to open at the tip of the flocculus through the lateral aperture of the fourth ventricle. This is the cerebellopontine angle. This is the opening of the lateral recess of the fourth ventricle. This is the choroid plexus bulging through this opening. This is the flocculus. This is the ninth cranial nerve just anterior to the lateral recess. This is the seventh and eighth nerves emerging at the cerebellopontine angle, just above the flocculus. A cerebellopontine angle tumor will compress all these structures. The roof of the fourth ventricle is formed from above by the superior medullary velum extending between the two superior cerebellar peduncles, and from below by the inferior medullary velum extending between the two inferior cerebellar peduncles. This inferior medullary velum is removed with the cerebellum to expose the floor of the fourth ventricle. Inside the ventricle projects a choroid plexus of arteries surrounded by pia mater called tela choroidi of the fourth ventricle. It extends laterally on each side as far as the lateral aperture of the ventricle. This is the floor of the fourth ventricle. It is diamond-shaped and is bounded on each side by the superior peduncle, inferior peduncle, cuneate tubercle, and the gracile tubercle from above downwards. It is formed of a pontine part belonging to the back of the pons and a medullary part belonging to the back of the open medulla. The junction between the two parts is demarcated by bundles of fibers which run transversely from the median groove laterally towards the inferior peduncle and are called the medullary striae. The pontine part shows a medial swelling, a lateral swelling, and a superior fovea in between. The medial swelling, one on each side of the median groove, is called facial colliculus and is formed by the abducent nucleus together with the fibers of the facial nerve curving around it. The lateral swelling overlies the vestibular nuclei and forms the upper part of the vestibular area. This is the superior fovea, which is an angular depression between the two elevations. The medullary or lower part of the floor is divided by a depression called inferior fovea into three triangles. The medial triangle lies over the hypoglossal nucleus and is called hypoglossal triangle. The intermediate triangle overlies the dorsal nucleus of the vagus and is called the vagal triangle, while the lateral triangle overlies the vestibular nuclei and forms the lower part of the vestibular area.